Die Reinigung kann das Leben retten, denn auch wenn sich unsere Leber relativ schnell regenerieren kann, 12 cm lang und rund 4 bis 6 cm breit. Die Nieren wiegen zusammen nicht mehr als 300 Gramm. Ihre Oberfläche ist übrigens glatt. Es sind die Harnleiter, die sie mit der Blase verbinden. Urinieren sie den Körper. Sie reinigen das Blut von Giftstoffen, indem wir diese durch den Urin ausscheiden. Diese Giftstoffe entstehen meist während des Stoffwechsels. Zum anderen regulieren die Nieren den Flüssigkeitshaushalt im Körper, so mit einem gesunden Lebensstil und einer ausgewogenen, gesunden Ernährung erfolgen. Es kann übrigens viele unterschiedliche Ursachen für Probleme mit der Niere geben. Zitronenwasser. Auch Zitronenwasser kann Nierensteine auflösen, zahlreiche Beschwerden geht. Auch bei einer Nierenreinigung kann Natron helfen. Das Natron wirkt wie ein natürlicher Elektrolyt, der dafür sorgt, dass sich dein Säurebasenhaushalt wieder reguliert. So zweimal täglich einige Gramm Kürbiskerne zu dir nehmen, denn dies hilft, den Harntrakt gesund zu halten. Auch bei Prostatabeschwerden können die Kerne übrigens helfen. Verzicht kann zu Nierenproblemen führen. Zudem ist Zucker auch für eine Vielzahl anderer Krankheiten verantwortlich. Besonders kommt mit weniger Salz aus. Dies bedeutet, dass du am besten auf Fertigprodukte verzichtest.
Calcium oxalate, calcium phosphate, struvite, uric acid, and cysteine. From the kidney into the ureter. If a stone continues to grow until it reaches a critical size, which can be as small as 4 to 5 millimeters in diameter, it may be too large to pass easily through the ureter. The edges of the stone may become wedged inside the ureter at the ureteropelvic junction, where the ureter crosses over the iliac artery, or at the ureterovesical junction. The result? Pain and obstruction until the stone slowly passes into the bladder and eventually passes out of the body in the urine stream. In the U.S., it is estimated that 13% of men and 7% of women will develop a kidney stone during their lifetime. Fortunately, in about 78% of these patients, stones will be expelled spontaneously. But stones that become lodged in the ureter may require lithotripsy, or percutaneous or endoscopic removal. It's important to note that nearly half of all first-time stone formers will have another stone episode within the next 4 years. Recurrent stone formers are at even greater risk and may form a new stone every 2 or 3 years. But what actually causes crystals to form? Why do some crystals develop into kidney stones and others do not? One critical factor is supersaturation of the urine with stone-forming salts. Supersaturation is the driving force for crystallization, which is why people living in areas with high temperatures and humidity have a higher incidence of stone formation. A diet high in sodium is a double risk because it increases calcium excretion and reduces urinary levels of stone-inhibiting citrate. Too much animal protein creates similar problems, encouraging stone growth by increasing urinary uric acid and reducing urinary citrate. Certain medications with a combination of diet and lifestyle changes and medication. Compliance with proven management guidelines, such as increasing fluid intake and avoiding stone-promoting foods, can significantly reduce stone recurrence. Medical therapies, such as thiazide diuretics and potassium citrate, are also highly effective in appropriate patients and can reduce the need for expensive assisted stone removal procedures, such as
Your circulatory system and kidneys are like yin and yang. They're interconnected and totally dependent on each other. The kidneys have small nephrons that filter waste and extra fluids from the blood. If the blood vessels get damaged, the nephrons that filter your blood don't get enough oxygen and nutrients. That's why high blood pressure is the second leading cause of kidney failure. There is a way to manage your high blood pressure to avoid kidney failure. What you need to do is add foods rich in folic acid to your diet because it helps with the production of red blood cells and can help prevent anemia. Folic acid boosting foods include leafy greens, citrus fruits, cereals, rice, and pastas, to name a few. Number 1, changes in urination. So we talked about how your kidneys are responsible for producing urine and eliminating waste through it. As disgusting as it sounds to examine the stuff, do not ignore any changes in the frequency, smell, color, and appearance of your urine. There are 3 most common types of changes to look for. First, an increased need to urinate, especially at night. Anywhere between 4 to 10 times a day is considered normal if you don't drink more than usual. Second is seeing blood in urine. Yeah, that definitely doesn't belong there. Healthy kidneys filter waste from the blood to produce urine, but if the filter is damaged, the blood cells might start to leak out into the urine. And the third most common change is having foamy urine. Bubbles in the urine, especially the ones that require you to flush several times until they go away, indicate that unwanted protein is in the urine.
Stones form inside the body, but unfortunately, they're extremely painful to get out. A kidney stone is a hard mass of crystals that can form in the kidneys, ureters, bladder, or urethra. Urine contains compounds that consist of calcium, sodium, potassium, oxalate, uric acid, and phosphate. If the levels of these particles get too high, or if urine becomes too acidic or basic, the particles can clump together and crystallize. Unless the problem is addressed, the crystals will gradually grow over a few weeks, months, or even years, forming a detectable stone. Calcium oxalate is the most common type of crystal to form this way and accounts for about 80% of kidney stones. Less common kidney stones are made of calcium phosphate or uric acid. A slightly different type of stone, made of the minerals magnesium ammonium phosphate or struvite, can be caused by bacteria. Stone travels through the kidney and into the ureter. Its sharp edges scratch the walls of the urinary tract. Nerve endings embedded in this tissue transmit excruciating pain signals through the nervous system, and the scratches can send blood flowing into the urine. This can be accompanied by symptoms of nausea, vomiting, and a burning sensation while urinating. If a stone gets big enough to actually block the flow of urine, it can create an infection or backflow and damage the kidneys themselves. But most kidney stones don't become this serious or even require invasive treatment. Masses less than 5 millimeters in diameter will usually pass out of the body on their own. A doctor will often simply recommend drinking large amounts of water to help speed the process along, and maybe taking some painkillers. If the stone is slightly larger, medications like alpha blockers can help by relaxing the muscles in the ureter and making it easier for the stone to get through. Another medication called potassium citrate can help dissolve the stones by creating a less acidic urine. For medium-sized stones, a rigid tube called a stent can be placed in the ureter to expand it. Optical fibers can deliver laser pulses to break up the stone. Stones can also be surgically removed through an incision in the patient's back or groin. What about just...
Έτσι, θέλουμε θερμότητα, ζέσταμα καλό, εισπνοή, εκπνοή.
Metallic taste in the mouth. When there's too much waste in the blood, it creates a kind of metallic taste in your mouth, which will affect how you taste food. I'm having too many toxins and other sorts of contamination in the bloodstream. Yeah.
Διαφραγματική αναπνοή, εισπνέω, εκπνέω. Εκπνέω. Έτσι. Εισπνέω. εκπνέεις. Πιο αργά. Έτσι.
Up to about 10 millimeters, one option is pulverizing them with sound waves. Extracorporeal shockwave lithotripsy uses high-intensity pulses of focused ultrasonic energy aimed directly at the stone.
Έτσι, εκπνέεις, το κεφάλι γυρνάει μαζί, πίσω να βλέπει το κεφάλι.
Es ist auch so, dass die oberflächlichen Muskeln die Spannungszustände der inneren Organe mit beeinflussen. Das bedeutet, entspannt man hier diesen Bereich, entspannt man auch die Nieren mit und dann wird auch dieses schmerzhafte Abgehen der Steine durch diese nachlassende Spannung reduziert.
Εκπνέεις, εκπνέεις. Έτσι, το κεφάλι πίσω, πετάω στα νεφρά, εισπνέω. Αργά, πέφτω μπροστά. Έτσι, τα χέρια από κάτω. Διπλώνω καλά. Έτσι, τώρα ανεβαίνω από μέσα. Εκεί. Κρατάω, πιέζω. Εκεί κρατάμε. Σούπερ. Έτσι. Και αναπνέουμε τώρα. 4-0. Έτσι. Αργά με εισπνοές. Μέχρι κάτω, μέχρι κάτω, μέχρι κάτω. Τα χέρια δεν σηκώνουμε. Ωραία, ισορροπιστής πλάτης στα νεφρά και αυχένα. Τα χέρια και τα πόδια χαλαρά. Και κάνω εισπνοή 4, 7, 8.